Today I'll be talking about blood pressure sensors, and in order to do that, we first need to talk about what blood pressure is. Blood pressure is measured using two numbers. The first number, which is called the systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. These two numbers are important and provide the most accuracy when reported together. This is where the different types of blood pressure sensors come in. The first type of sensor that I looked into was the blood pressure cuff, and this is the type of sensor that all other sensors are based off of. The diagram shown on the screen shows how the blood pressure cuff works. When the cuff is inflated, the arterial blood flow is cut off. The cord cough sounds are created by pulsatile blood flow and can be heard through the stethoscope as the pressure of the cuff is released. This is when the systolic blood pressure is recorded. When the blood flow is silent and the artery is no longer compressed, this is when the diastolic pressure is recorded. There are many different wearable blood pressure sensors that are on the market today. The most notable are the wrist cuff and the wearable watch. The wrist cuff utilizes the same methodologies as the standard blood pressure cuff, where it compresses and deflates in order to detect the blood pressure. The wearable watch uses an EKG and heart rate sensor to gather data. From the data that is collected, they use an embedded system that calculates the blood pressure from the two readings. The blood pressure is most accurate when the user of the device is at rest and the placement of the device is in the correct location. Many of the watches require that the arm is level with the heart in order to obtain an accurate reading.